Welcome everybody. With you, Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about can he get HIV from oral sex? So this is a very important question. Oral sex has very low risk of HIV transmission. The virus can very rarely be passed on this way, and only if the person with HIV has a detectable viral load. What is the risk from oral sex? This is another question. Results from the studies shows that if someone with HIV is taking effective HIV medication and has an undetectable viral load and has HIV, they cannot pass on HIV. According to the Public Health England, around from 1 to 3% of sexual HIV transmission in the UK are because of oral sex. Other studies found that the risk is very low but is not zero. Unprotected anal and vaginal sex leads to far more HIV infections than oral sex. The risks are higher if the person giving oral sex has cuts, sores, or abrasions in their mouth or gums, a sore throat or infection in the mouth or throat, or if the person receiving oral sex is HIV positive, has detectable viral load, has any cuts, sores, or inflammation on the genital area. Other sexually transmitted infections such as gonorrhea, chlamydia, herpes, and syphilis can be passed on through oral sex. Receiving oral sex from someone with HIV, even if their viral load is detectable, this is considered to be an extremely low risk. Infection would really only be possible if someone with HIV was giving someone oral sex when their mouth was bleeding. Performing oral sex on someone with HIV, there is a potential risk if an HIV negative person performs oral sex or on someone with a penis who is living with HIV with a detectable viral load. This risk increases if a man's infected precum or semen gets into the other person's mouth. Avoid getting semen in your mouth. All but one of the cases where someone has been infected with HIV through oral sex took place when an HIV positive person with detectable viral load ejaculated into their mouth. Using a latex barrier over the vagina can protect against sex transmitted infections and the very small risk of HIV transmission. Oral sex when someone is on their period carries a greater risk, but only if they have a detectable viral load. Reducing the risk from oral sex. The risk from unprotected oral sex with someone with a detectable viral load increases if you have a throat infection, including an sexually transmitted infection in the throat, damage to the lining of the mouth or throat, had recent dental work on your gums, bleed a lot, avoid performing oral sex without protection on someone with a detectable viral load while you have any of the above. Don't floss or brush teeth before oral sex. Chew gum or rub toothpaste on your teeth instead. Regular checkup for sexually transmitted infections will pick up infections in your throat. By cutting down on the number of oral sex partners, you make the very small HIV risk even lower. How can you prevent getting or transmitting HIV through sex? There are several ways to prevent getting or transmitting HIV through anal or vaginal sex. If you are HIV negative, you can use HIV prevention medicine known as pre-exposure prophylaxis or post-exposure prophylaxis to protect yourself. You can also use other HIV prevention methods. If you have HIV, the most important thing you can do to prevent transmission and stay healthy is to take HIV medicines known as antiretroviral therapy, exactly as prescribed. People with HIV who take HIV medicines as prescribed and keep an undetectable viral load can live long and healthy lives and will not transmit HIV to their HIV negative partners through sex. This is sometimes called HIV treatment as a prevention or undetectable, untransmissible. There also are other options to prevent transmitting HIV. Preventing getting HIV, some sexual activities carry a much higher risk of HIV transmission than others. Educate yourself about HIV risk and how you can reduce it. If you are HIV negative, you have several options for protecting yourself from getting HIV through vaginal or anal sex. The more these actions you take, the safer you can be. To prevent getting HIV through sex, you can choose less risky sexual behaviors. HIV is mainly spread by having anal or vaginal sex without a condom or without taking medicines to prevent or treat HIV. Here is some information about the HIV risk associated with specific sexual behaviors. So, receptive anal sex is the riskiest type of sex for getting or transmitting HIV. The partner inserting the penis in the anus or the partner receiving the penis to get HIV, but it is much riskier for an HIV negative partner to be the receptive partner. Thank you very much.